everyone, I'm Dr. Malaika. In this series, we will focus on the endoparasites of dogs and cats, specifically the common intestinal worms. I'll be talking about the infamous heartworm in my next series, so do check that out too. Let's start off with understanding what a parasite actually is. Parasites are organisms that live within or on another organism and survive by taking nutrients from them. Endoparasites, or internal parasites, are those parasites found within the body of the host, in our case the dogs and cats, and the intestinal worms are a prime example. As the name implies, intestinal worms are worms found in the intestines. A variety of intestinal worms parasitizes our dogs and cats. These worms are often categorized based on their appearance. The common ones include the roundworms, hookworms, and tapeworms. In general, this is how they look like. So the roundworms of dogs and cats are usually white or tan in color and are a few inches in length. Actually, they look a lot like spaghetti. Hookworms are generally smaller and their anterior end is slightly bent, giving it a fishhook appearance, thus the name. They are also special as they have teeth which can be seen under the microscope. Tapeworms are segmented and can grow very long. Often the segments break off and can be found in your dog or cat's poop or around their anus, and these segments look like rice grains. There are a number of ways our pets can be infested with these intestinal worms. The worm eggs are passed out in the feces, contaminating the soil. The eggs are very hardy and can survive for prolonged periods in the environment. Did you know that one Toxocara female roundworm can lay up to 200,000 eggs in a day? So you can just imagine how many eggs are shed in the feces of an infected dog or cat. Therefore, pets can get infested through a number of ways. 1. Exposure to contaminated soil or feces. 2. Grooming or licking an infested animal. 3. Eating paratenic hosts. And finally, also don't forget that puppies and kittens can be infested during nursing. Knowing the life cycle of the worms is very important, not only for veterinarians, but also for you as a pet parent. It allows us to target these parasites so that they cannot infest our pets. It also makes us realize the necessity to protect our pets early in life, as they may be infested through the mother's milk or even through a contaminated environment at birth. Understanding the parasite can help us understand this real threat to our pets and also encourage us to do something about it. Let's start with the roundworms. Toxocara species is the most common roundworm infesting dogs and cats. The life cycle of this roundworm is rather complicated, but simply put, it begins with an infested dog or cat that passes out the worm eggs in its feces, which embryonates shortly after. Another passing dog or cat ingests this embryonated egg from the contaminated soil, and the larvae hatch out in the dog or cat's gastrointestinal tract. Larvae will migrate through the muscle, liver, and lungs before returning to the intestines to mature into adults. This migration usually occurs in younger animals. Finally, adult worms begin to reproduce, and eggs will be excreted in the feces, thus completing the life cycle. Transmission may also occur through the ingestion of paratenic hosts, such as cockroaches, earthworms, rodents, and birds. In older dogs, larvae are more commonly dormant in tissues and may be reactivated, especially when the female dog is pregnant. In dogs, the larvae crosses the placenta to infect the unborn puppy, and this tends to be a major route of infection of puppies. This doesn't happen in cats. Transmammary infection is the major route of roundworm transmission in kittens. The immature roundworms, called larvae, are present in the mother's mammary glands and then are passed to her kittens in her milk during nursing. This rarely happens in puppies. So that wraps up the roundworms. Let's continue with the hookworms. Hookworms have a few unique features. Did you know that some hookworms can complete their life cycle in a mere 2 weeks? That's really fast. What it means is that after you deworm your dog or cat, and if they get reinfested, they could be shedding worm egg in their feces in as little as 2 weeks. Infested dogs and cats pass out the hookworm eggs in the feces. The eggs are hatched into larvae after several days under warm, moist conditions. This is where it's different from the roundworms. For roundworms, the eggs have to embryonate first before they're ingested. Only then they will hatch into larvae in the intestines. So how does this make the hookworm's transmission a concern? Well, hookworm larvae can readily infect dogs and cats in several ways. First, they may migrate through the skin, usually from the paws, or second, directly during grooming if the larvae are on the fur. Dogs or cats may also be infested when they eat another animal, such as an infested rat. Similar to roundworms, once the hookworm larvae get into a dog or cat, they will migrate through the muscle, liver, and lungs before returning to the intestines to mature into adults. Some larvae will migrate to various other tissues or organs and stay dormant there. They only become active later, especially when the dog becomes pregnant. That's when they can enter the milk and infest puppies. Unlike roundworms, transplacental transmission of hookworms is very rare in dogs. Now let us look at the life cycle of tapeworms. Dipylidium caninum is one of the most common species of tapeworm to infect dogs and cats. The Dipylidium tapeworm life cycle begins when the segments of the tapeworm living in the dog's or cat's small intestines is passed out into the environment in the poops. Once released in the environment, these segments release eggs, which are consumed by flea larvae, the tapeworm's intermediate hosts. Once the flea larvae develop into adults, all it takes for a dog or cat to get infected is to ingest the infested flea by grooming him or herself. In the small intestine, it attaches and matures into an adult. Once established, within only 2 to 3 weeks, the tapeworm is already capable of releasing tapeworm segments containing eggs, allowing the life cycle to start all over again. So you see, by understanding the life cycle of these intestinal worms, you now have some idea as to how pets get infested. It has also given us a clue about possible clinical signs based on the worm behavior. And finally, not forgetting the possible effective strategy to prevent the infection. Believe it or not, intestinal worms can be a big deal in dogs and cats. They can cause severe life-threatening conditions and should not be treated lightly. Knowing the clinical signs associated with these worm infestations can help us prevent a tragedy. Toxocara roundworms are not particularly harmful to adult dogs and cats, but large numbers may cause life-threatening problems in puppies and kittens. In puppies and kittens, common clinical signs include a pot-bellied appearance, abdominal discomfort, decreased appetite, dull hair coat, vomiting, and diarrhea or poor growth. Sometimes these worms are vomited out or can be seen wriggling and writhing in their stool. Hookworms attach and bite the intestinal wall to suck blood, causing injury and bleeding. That's why an infested dog or cat will often have black stool as a result of digested blood. If the infestation is heavy, the pet may become anemic due to severe blood loss. More severe disease is commonly seen in puppies and kittens rather than adults. The good thing about Dipylidium tapeworm, well, if there is anything good about them, is that they're pretty harmless and cause little or no clinical signs in dogs and cats. The cat or dog will usually scoot or drag their bum across the ground due to irritation caused by the segments around the anus. Having said that, emaciation can be seen in underfed or severely infested animals or in growing puppies and kittens. Keep in mind though that there are certain species of tapeworms that may cause more severe clinical signs and devastating disease in dogs and cats. If the actual worms are seen in the vomitus or stool of your pet, you may suspect a roundworm or hookworm infestation. You would be able to suspect a tapeworm infestation if you see the segments around the anus of your pet or see it in the stool. However, the best way to confirm an infestation is to visit your veterinarian, as these worm infestations may go unnoticed by us, posing a risk to both our pets and us. Now, you may be wondering if these intestinal parasites of dogs and cats are a risk to us. Are they also dangerous to humans? The answer is yes. These worms may be dangerous to humans as well. The Toxocara roundworm eggs can infest humans if ingested accidentally in dirt or sand. Though most humans will not show any signs, in the worst case scenario, it may cause blindness when the larvae migrate to the eye, or if the larvae migrate to other organs, it may cause signs such as abdominal pain, coughing, and fever. Children are at greater risk because they like to play in dirt and sand and put their hands in their mouths. The hookworm larvae can penetrate our skin and cause a hypersensitivity reaction. This is called cutaneous larvae migrans. Some species of hookworms can also cause inflammation in the intestines of humans, leading to diarrhea and abdominal pain. The tapeworm of dogs and cats can cause diarrhea in humans when a flea carrying the larvae is ingested. Although this is a rare scenario, but children are at greater risk of being infested. So again, these intestinal parasites of dogs and cats may also be dangerous to us. Therefore, proper prevention is very, very important. And parasiticides are a must because they are the only surefire way to kill the worm and worm stages and protect your pet from infestation. An accurate diagnosis of intestinal worm infestation is crucial. It is therefore advisable to take your pet to the veterinarian if an infestation is suspected. This is because your veterinarian will know how to properly treat your pet and will advise you about how to prevent your pet from being reinfested. Once you've learned how the product should be given or applied in the correct way and have been informed about any precautions with regards to the use of the product at your veterinarians, you can give or apply the product yourself at home. You must make sure that you deworm your pet every month in order to protect your pet. It is important to continue using dewormers even if you do not see the worm. A lot of these dogs and cats may be infested and not be showing any clinical signs, but they will be shedding eggs and contaminating the environment. And do you remember, if they are infested by hookworms or roundworms, the worm's larvae may stay dormant in their body and may start to infest their litter if they are pregnant. Parasiticides produced by reputable companies are very effective and their safety profiles are well established. It is always important to know the earliest age these dewormers can be started, as well as if they are safe for pregnant or nursing pets. Also, if your pet is diagnosed with other serious disease, you will need to know if the products are safe to be used. Always seek the advice of your veterinarian. At the correct dosing and correct application technique, these dewormers are relatively safe. However, as with any drug on rare occasions, side effects may be noted depending on the product used. Most of the reactions, however, are self-limiting. There are some natural remedies that are being studied and show some effect against parasites. However, the ideal dosing and use as regular dewormers have not been validated as of yet. The frequency of applying or giving a dewormer will depend on the product itself, but most dewormers in the market recommend monthly dosing. With all this information, we hope you have a better picture about the intestinal worms of dogs and cats. Don't take them lightly. Take action. We all have responsibility to protect our pets and our community.